is Lee. I'm a nurse practitioner student, and I'm gonna conduct the visit today.
Okay.
So before we begin, I just want to ask for your permission so during this visit, you can provide me the medical history, also your family history, and I'm gonna conduct a physical exam on you, like touching, listen, palpate. Is that okay?
Yeah.
And also because of the training and education purposes, I'm gonna record this visit. Is that okay with you?
Yeah.
Okay. May I know what brings you to the clinic today?
I have a runny nose and also it's itchy and the coughing also very irritable and it's make me uncomfortable.
I'm so sorry about the symptoms. I'm gonna ask more questions.
Yeah.
We're gonna work together, so hopefully I can help you feel better. Okay?
Yeah.
Right. May I know when did the runny nose, the itchy nose start?
6 days ago.
6 days ago. Do you have the itchy and runny nose constantly during the day, or it comes and go?
Constantly.
Constantly. And is there any pain in your nose?
No.
Just the itchy?
Yeah.
Do you do anything to make it feel better, to stop the runny nose?
I bought the new mat, the saline solution from CVS. Try to rinse it twice a day.
Twice a day?
Yeah.
Do you think the solution helped?
Well, it helped after you rinse it, but then it come back the symptoms.
Okay, so the symptom persists?
Yeah.
Do you think what makes the runny nose and the itchy nose worse?
The cold weather, the weather is cold and it make everything worse.
Do you think you feel like the itchy and runny nose worse when you go outside or inside the house?
Outside.
Okay. And you mentioned that you also have a cough?
Yeah.
When did the cough start?
4 days ago.
4 days ago. Is there any pain associated with the cough?
Yes, the throat is.
You have sore throat?
Yes.
Yeah. So can you rate your pain from 0 to 10?
2 out of 10.
2 out of 10. Okay. Do you take any medication to help the coughing?
No, I only drink warm water with lemon and ginger. That's all I'm doing.
Oh, so do you think that the drinks help with the coughing?
Yeah.
Yeah. Thank you. And the coughing, is this constantly during the day, or it comes and goes?
Constantly.
Constantly.
Yeah.
Okay. All right. So may I know, do you have any existing medical condition? Like past medical history?
I had malaria as well as ear infection before.
When did it happen?
Around 7 or 8 year old, but it's already.
So it happened when you were 7 years old?
Yes.
Okay. And do you have any past surgical history?
No.
No past surgical history. When was your last physical?
Last year.
Last year? Is there any abnormal finding during that visit?
No.
When was your last pap smear?
May 2023.
So a couple months ago. Any abnormal finding?
No.
Okay. When was your last menstrual cycle?
October 25th.
So October 25th, so it's coming. Do you have any allergies to medication?
No.
Any allergies to food?
No.
Any allergy to environmental factor that you know of?
I would say the weather.
The weather?
Yeah.
That's what you suspect?
Yeah.
Oh, okay. Are you taking any prescribed medication?
No.
Are you taking any over-the-counter medication?
I'm taking a woman probiotic.
Yeah.
Is that count?
Oh, yeah.
Yeah.
Yeah. So how many times a day you take the women probiotic?
It will be 1 or 2, but one per day.
1 per day?
Yeah.
Okay. 1 capsule a day?
Yes.
Okay. Do you smoke?
No.
Do you drink alcohol?
1 or 2 drinks per week.
Do you vape? You use the electronic Smoking? No. Do you use any other illicit drug?
No.
Can you tell me about your living situation? Do you have any pets?
Right now I'm living in the 2-bedroom apartment with my roommate, and I have a cat and a dog, and I've been living with them for 4 years.
So you've been living with them for 4 years and there's no problem at all?
No.
Can you tell me about your occupation now? What do you do?
I'm currently working as a research associate for drug discovery and development.
Wow, very interesting. So you work in a lab? Do you like have to work directly with like chemical substances?
Yes. Yeah.
Do you wear any protective
PPE,
gloves?
everything.
Everything? And how long have you been a research associate?
Almost 3 years.
Almost 3 years. And do you think the symptoms, like the new symptom, associate of anything that you work with?
No.
No, you don't think so. So, how you sleep? Do you sleep enough? Is the symptoms interfere with your sleeping?
It definitely interferes with my sleep. When I have the symptom like coughing or runny nose, and then I woke up, it's very difficult for me to get back to sleep.
Okay. I'm so sorry about that. I'm gonna try to help you, okay? So your vaccination is up to date? You got the flu vaccine this year?
Yes.
Okay, thank you. Do you have any family history that you want to tell me? How's your mom's health?
Normal.
Normal? She has no health condition. How's your dad?
Normal as well.
No health condition. You have any family history of head issue?
No.
Any family history of eyes issue?
No.
How about family history of ears issue?
No.
Any family history of nose issue?
No.
Any family history of mouth or jaw issue? Any family history of neck or throat issue?
No.
Okay, thank you. So, do you have any fever?
No.
Any chills, loss of appetite, weight loss, night sweat? Okay. You have any history of head trauma, head surgery?
No.
You have any eyes problem?
A little bit itchy eyes.
When did the irritation start?
2 days ago.
2 days ago. Do you do anything for the itchy?
I wash it with water.
Yeah. Does it help?
Yeah.
Okay. You don't use any medication?
No.
Beside that, any history of eye surgery, eye trauma?
No.
And you mentioned you have the runnies and itchy nose. Beside that, do you have any past trauma to your nose?
No.
Any surgery history?
No.
Any ears issue?
I have.
Beside the ear infection?
Okay, then don't.
Yeah. Any past trauma surgery?
No.
Any mouth or jaw issue?
No.
Any neck or throat issue? Beside the coughing, sore throat, you have any neck trauma surgery?
No.
Okay. And how about your breathing?
It's normal.
It's normal. Shortness of breath?
No.
Any difficult breathing?
No.
Okay. Now I'm gonna take vital sign. Your vital sign, okay? So I take a balanced vital sign bilaterally. The reading, the vital signs are within normal limit. Now I'm gonna listen to your heartbeat, okay? Aortic area. I appreciate physiologic S1 and S2 in aortic area, pulmonary area, burst point, tricuspid, and mitral area. So that's the healthy and normal finding. I don't appreciate any extra heart sound, abnormal or murmur heart sound. Now I'm going to listen to your lung sound in your back. Can you turn to your back, please? This way, so the camera can see your back. Thank you. So I should listen without the clothes, but for the purpose of the video, so Bella can wear her clothes. Can you take a deep breath for me? Take a deep breath. Take a deep breath. 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 Deep breath for me, please. Deep breath for me, please. Thank you. I appreciate clear lung sound bilaterally, posteriorly. I don't appreciate any advantages lung sound bilaterally, posteriorly. Now I'm gonna listen to lung sound and in the front, okay? Can you turn to your normal position? Thank you. You take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. One more time, deep breath. Deep breath. Yeah. I appreciate clear lung sound bilaterally, anteriorly. I don't appreciate any advantages. Abnormal lung sound anteriorly, bilaterally. Right. Now I'm gonna inspect your head for any abnormality. I can see your hair is well distributed. Dark pigmentation originally. No visible rashes, lesion, abscess. And the head of the shape of the head is round, no depression. I'm gonna palpate your head, okay? Let me know if you feel any tenderness or pain. I don't appreciate any depression, hematoma, tenderness, palpable lesion, abscess. Do you have any pain or tenderness? I'm just gonna inspect your eyes. Your eyes are symmetrical bilaterally. No visible lesion, abscess, exotomas, ptosis of the eyelid. I'm gonna pull your eyelid down with my thumbs. Can you look up for me? Look to the left, to the right, look down. I appreciate the conjunctiva is pink and moist. The sclera is mild injected because of the irritation. I appreciate the puncta opening is patent bilaterally. No foreign body visible. No abscess lesions bilaterally. Okay. Next, I'm gonna test the optic nerve, cranial nerve 2 with this card. So this is the pocket card, so I'm gonna stand away, 6 feet away. 6 feet away is around. Can you straighten your arm? Yes. But because of the purpose of the video, I'm gonna make sure that I'm in the frame. Okay. Can you cover your left eye for me, please? You can use this to cover your left eye. Can you read this slide for me?
L T F P H.
Now cover your right eye. Can you read this slide for me?
L T F P H.
So Alma's visual acuity is 20/20 bilaterally, so her optic cranial nerve 2 is intact. Now I'm gonna dim the room light and I'm gonna check her pupil. The room light is dim. Can you look straight for me? Bella's left pupil constricted from 5 millimeter to 3 millimeter when I shine the light the first time. When I shine the light the second time, Bella's right pupil also constricted consensually. Bella's right pupil constricted from 5 millimeter to 3 millimeter when I shine the light the first time, and the second time when I check for the left pupil also constricted consensually when the right pupil is constricted. So that's the healthy and normal finding. I'm turn on the line. Now I'm gonna test the extra oculomotor motion. So Bella, I'm gonna have you look at my finger. Cover your left eye for me, please. I'm gonna test the cranial nerve 3, which is the oculomotor, 4 trochlea, and 6 is the abduction. Okay. 3, 4, 6. Okay, now cover your right eye for me. 3, 4, 6. So cranial nerve 3, 4, and 6 are intact, and during the test, I don't appreciate any involuntary, repetitive, rapid movement of the eye. We also call it nystagmus. So it's negative for nystagmus. Next, I'm gonna test your conversion. So I'm gonna have you look at my pen light. Look straight at my pen light. And I'm gonna move the pen light close to your nose and follow the pen light with your eyes, okay? When you see the double vision, let me know. Okay, now keep looking. At the point Bella see the double vision, her bilateral eyes are fixed to the conversion point, and when I move the pen light away, her eyes are going back to the normal position. So that's healthy and normal finding. And I'm gonna check for accumulation. Can you look at the pen light? Can you look far away to the wall? Now look at the pen light and look far away to the wall. When Bella look at the pen light, her pupils constricted bilaterally, and when she looked to the wall, her pupil dilated bilaterally. So her pupils are accumulated. That's normal and healthy finding. Now I'm gonna test Bella's eye with the ophthalmoscope. I'm gonna dim the room light. Just gonna adjust the diopter. Now you look straight for me, okay? Now I'm gonna shine the light oblique to check for the cornea and the lens. The cornea is clear, no opacity in the lens in the left eye. The right cornea is clean, no opacity in the right lens, and no foreign body lesion absent. Appreciate bilaterally. And I'm gonna turn the room lights down. I'm gonna use my right hand, right eye to check Bella's right eye. I'm gonna stand away about 15 inches, 15 degrees away to look for the red reflex. We're gonna see the red reflex. I'm gonna move back closely to Bella. I put my left hand here. I'm gonna keep closer to check for the retina. After checking Bella's right eye, I appreciate the optic vessel. The artery is smaller. The arteries are smaller than the veins. The veins are brisk. When I follow the veins and artery, I can see the optic disc. The optic disc and cup ratio is 3:1, and in the center of the retina, I can appreciate the macula, which is darker. Within the macula is the fovea. That's the central vision. I don't appreciate any hemorrhage, cotton body, or detachment of the retina in the right eye. Now I'm gonna check for the left eye. I'm gonna use my left eye to check for left eye. 15 inches away, 15 degrees. When I see the red reflex, I'm gonna move closer. I'm gonna put my right hand here. After checking Bella's right eye, I can appreciate the retina, the vessel, which is the arteries, are smaller than the veins. When I follow the veins and artery, I can see the optic disc, which is yellowish orange color. The ratio of the optic disc and cup is 3:1, and the center of the eye is the macula. Darker within the macula is the fovea. That's the central vision. I don't appreciate any hemorrhage, AV nickeling, cotton body, or detachment of the retina. The retina is reddish orange color, and the retina is intact bilaterally. And next, I'm gonna turn the room light on. I'm gonna test the visual field. Can you please cover your left eye for me? And let me know when you see my wiggle fingers, okay?
Yes. 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 Yes.
Okay. Now cover your right eye.
Yes. 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 Yes.
Okay. Now look straight. Say yes when you see my wiggle fingers.
Yes. Yes.
Isabella passed the static wiggle finger test. Her visual fields are intact. Do you have any question for me for the eye exam?
No.
So now I'm gonna move to the exam of the ears. Just gonna remove the hair to inspect your ears. Your ears are symmetrical bilaterally. I don't appreciate any absent lesion, hematoma, swelling of the ear, of the external ear. I'm gonna do the top tap. Let me know if you have pain.
No. No.
Okay. I'm gonna just palpate the preocular charges, mastoid. Any pain?
No.
I don't appreciate any tenderness when I palpate preocular charges, mastoid. Any pain?
No.
I don't appreciate any tenderness on the left ear. No, and I don't appreciate any drainage of the ear. Now I'm gonna test the optic nerve vestibulocochlear. This is the that's the vestibulocochlear cranial nerve A to check for your hearing. So I'm gonna stand behind Bella 2 feet away. I'm gonna have Bella to press down the trousers in the circular motion. And I'm gonna whisper 3 words or letter and let me know if you hear me. I'm gonna stand away in the back, 2 feet away.
2E3 4M6.
Okay, now I'm gonna test the right ear. You're gonna press down the trousers in the circular motion. I'm gonna stand behind ear 2 feet away. I'm gonna move the chair right here. Okay. Let me know if you what you hear. Okay. 6 feet
6 feet 8. B57.
So the cranial nerve A clear is intact. Now I'm gonna test the rapid test. So I'm gonna tap this fork. I'm gonna put it in the middle of your forehead. You're gonna hear the ringing sound. Let me know if you hear that equally bilaterally or you hear it slightly louder in one ear, okay? You hear it equally bilaterally?
Yes.
Okay. So the Weber test is midline, that's healthy and normal fighting. Now I'm gonna move to the right test. I'm gonna tap this and put in your mastoid right here. You're gonna hear the ringing. Let me know when you stop hearing it. Then I'm gonna move the fork in front of your ear. Let me know when you stop hearing it, okay? I'm gonna check for the time.
Yeah. Yeah.
So AC is greater than BC. That's normal and healthy fighting. I'm gonna check your left ear.
Yeah. Yeah.
AC also greater than BC, and that's normal and healthy fighting. So right test, you passed the right test bilaterally. Now I'm gonna use the otoscope to check for your ear canal and the tympanic membrane. Make sure. So I'm gonna pull the helix up and back. I'm gonna make sure the safe distance. If you feel any discomfort, let me know. I'm gonna stop right away, okay? After I check Bella left ear, I appreciate the external canal is a flushing color, has more hair, and the auditory canal is intact. The tympanic membrane is intact. I can see the malleus and the cone of light in the left ear is 7 o'clock. Now similarly, I'm gonna check in your right ear. I'm gonna discard this one. You can sit here. Yeah. I'm gonna pull the helix up and back. Let me know if you feel any discomfort. Okay. After I check Bella right ear, I appreciate the external canals has flushing color, some small hair along the canal. The auditory canal is intact. The tympanic membrane is intact. Pearly gray color bilaterally. The cone of light in the right ear is 5 o'clock, and I can also see the malleus in the right tympanic membrane. Now I'm gonna check your nose, okay? So as inspection, I don't appreciate any deviation of the septum. The septum is midline. no visible lesion, abscess, deformity of the nose. I'm gonna also use the otoscope to check the mucosa of the nose, okay? Can you look slightly up for me? Okay. If you have any discomfort, let me know, okay? So after I check the nails bilaterally, I can see the mucosa is pink, slightly pale. I can see the clear discharge from your nose, clear thin discharge, and the turbinates are patent bilaterally. Now I'm gonna do the olfactory test to test your cranial nerve 1. So I have coffee. I'm gonna have Bella close her eye and smell this. Can you close your eye for me? You smell it? Let me know what did you smell.
Coffee.
So the olfactory cranial nerve 1 is intact. Now I'm gonna, can you just remove the, yes, just so I can see your neck. As in upon inspection, I don't appreciate any deformity, any deviation of the trachea, no visible abscess, lesion, hematoma on the neck. Okay. So before we move to the next, actually I'm gonna palpate the frontal sinus, okay? To make sure that you don't have any tenderness, any pain.
No.
Any tenderness?
No.
And the maxillary sinus? Any pain?
No.
Any tenderness?
No.
Okay, thank you. I'm gonna wash my hand. Now I'm gonna go back to your neck. Okay, can you turn to the left for me? Turn to the right. Look up to the ceiling. Tuck your chin to your chest. Any pain? Can you try to touch your ear to your shoulder? And this side? Any pain? Okay. Now I'm gonna put some strain right here to check for the left sternocleidomastoid muscle strain, okay? Now push again my hand. Okay. Now we check for the right sternocleidomastoid muscle. Push again my hand. Okay. The strain is 5/5 bilaterally. And now I'm gonna palpate for the lymph node. Pre-alveolar, not palpable. Post-alveolar, not palpable. Occipital, not palpable. Anterior cervical, not palpable. Posterior cervical, not palpable. Submandibular, I can feel lymph node mobile around 1 by 1 centimeter, non-tender. Now I'm gonna palpate I'm gonna palpate the lymph node at the submandibular, not palpable. Now I'm gonna palpate for the supraclavicle, not palpable. Now I'm gonna try to identify the glyphosate with my finger. From the chin, I'm gonna slide down. I can feel the thyroid cartilage. Move down is the thyroid gland. Feel it bilaterally, and move down is the cricoid cartilage. Okay. Can you swallow for me? When Bella swallow, I can see the thyroid cartilage, thyroid gland, and the cricoid move up and then down. Now I'm gonna stand behind you. Try to prepare right here. Okay, can you swallow for me? Yeah, I can feel the smooth motion, no nodule, and the thyroid cartilage. The thyroid gland and cricoid move up and down when you swallow. Now I'm gonna test for the accessory muscle, cranial nerve 11. But I'm gonna put some strain here, and you try to shrug your shoulder. Okay. Okay. The cranial nerve 11 is intact. Okay. Now I'm gonna check your mouth. I'm gonna inspect the lips. The lips is pink. No visible lesion abscess. Can you open your mouth for me, please? Okay, I can see the buccal. I'm gonna use the tongue pressure. Okay. I can see the buccal mucosa is pink and moist. I don't appreciate any lesion, abscess. Can you move your tongue up for me, please? I can see the salivary duct opening are patent. And I'm gonna check your gum, okay? Yeah, I don't appreciate any lesion, hypertrophy, discoloration, abscess in the gum. I'm gonna check your tongue. Can you stick your tongue out? I don't appreciate any enlargement, hypertrophy, abscess, lesion in the tongue. I can see the appropriate size of the papilla. Okay, now I'm gonna check the soft palate and uvula. Can you open your mouth for me, please? I'm gonna depress the tongue, okay? I can see the soft palate and uvula is midline. I'm gonna depress the tongue. Can you say so now I'm gonna test the vagus and cranial nerve 10 and cranial nerve 9. Can you say Yeah. When Bella say I can see the soft palate and the uvula move up centrally, and that's expected fighting. Now I'm gonna test the hypoglossal cranial nerve 12. Can you stick your tongue out for me? I'm gonna push again the cheek and use your tongue to push again my hand, okay? Cranial nerve 12 is intact. The strength is 5/5. Now I'm gonna inspect the tonsil. You open your mouth for me. I can see the tonsil is my erythema. Tonsil grade is +2. No postnasal grief. Dentition is good. No missing teeth. No deformity. No cavity. Okay. Thank you so much. Do you have any question for me, Bella?
No.
So I'm gonna put the finding in your charts on the patient portal. So try to look up the results. If you have any question, just message me or give the clinic a call, okay?
Yep.
Thank you for your time today. Have a good one.
Thank you.